Hi, I'm Dr. David Menard, and I'm here with Maggie and Mark. And we're going to do a complete physical exam for a wellness care visit for Maggie today. And we're going to visit with Mark a little bit about what's been going on with Maggie in her life since last time she visited here. So in a complete physical exam, we're going to go through all aspects of Maggie's body and determine if there's anything that Mark has seen at home that might be abnormal or anything that we see on physical exam here. So I'm just going to start doing a physical on Maggie, ask Mark some questions, and then we'll see if we find anything with her today that's going to need to be addressed in the future. So Mark, how's Maggie been at home? Have you had any problems with her at all?
No, she's been doing real well.
Now, I'm checking her eyes out, making sure they're clear, there's no problems with her corneas or anything like that. Any itch and scratching that you've noticed in her body at all?
No.
No fleas or anything like that on her?
We've been really fortunate so far with that medicine you give us. It
using
works.
Confortis with
Right.
your pet at home. That's great flea control. Any scratching at her ears going on?
No, she's been doing real good.
Okay, very good. What's her breath been like for you at home?
She's pretty good. You know, sometimes she has morning breath, but
let me show you this, Mark, because generally, you know, we don't look at the back teeth like this. We'll look at our pet's front teeth. Her front teeth are pretty clean, but when you look back here in this back tooth, you really got to pull that gum back. You can see how much tartar and debris are back there, and she is definitely going to be in need of getting her teeth cleaned pretty soon. Okay. Listen to her heart and lungs real quick. No coughing at home?
No.
The reason we ask that is the number one sign of a heart disease in any dog is a cough. Maggie's not really old enough to really be one that we'd be concerned that much about having congestive heart failure or congestive heart disease. But in the future, if you do run into some coughing issues, that's something you want to let us know about. What about limping at home? Any stiffness getting up and down?
Just so every once in a while, not usually.
Yeah, more in the hind end?
Yes, sir.
He just flicks her hips here a little bit. You know, not really exhibiting any discomfort or pain at this point. Again, age-wise, she's just middle-aged, 6 years old. She's not really at a point that she's probably should have a lot of arthritis, but again, just keep in mind, when she starts to having issues and her activity level changes at home, there are great medications for pain control and other type of modalities from laser therapy, acupuncture, as well as Remedil and Reliance for oral pain medication. You can take it home when she needs it. She's probably not at that stage just yet. Coat and skin good, eyes are clear, ears no problem. Mouth, again, we need to address that at some point. Get her teeth cleaned here pretty soon. Any inappropriate urination in the house?
No.
Okay.
She's been good.
And her weight, honestly, for a Corgi is great. I mean, these dogs do have a tendency to carry a little extra weight, so you're doing a great job feeding her. At her age, though, I do recommend she should be on a low-fat diet at this point. And I'll write that right here for you. That's her intranasal bordetella. Come around here, sweetie. And that's her parvo distemper combination vaccination for her annual. And I think we've already elected that we're going to use ProHeart 6 for her,
Right.
for her heartworm prevention at this point in time. Whoop, one more. Back around here, darling. Last one. Maggie, you've been a trooper. As always, you're a very sweet girl. We're going to get you in here. We're going to get your teeth cleaned, and you're going to be in great shape for another year or so.